Hello, in this video I'm going to be talking about how long treatment takes and what's the order of the different treatments that are offered in somebody undergoing treatment for breast cancer. Before I go on, I'd love to invite you to subscribe to our channel. We put out updated videos, new videos, often in response to your requests and comments. So thank you for that, and don't forget to subscribe. So when you start the whole breast cancer experience, you start usually with a diagnostic procedure, some images, meaning pictures of the breast. We start with mammograms, ultrasounds, maybe an MRI, and a biopsy has to be done to see whether it's cancer. Even if the doctor, the radiologist who looked at the pictures is pretty sure it's cancer, or the person who did the examination is pretty sure they're feeling a cancer, we absolutely need to have confirmation under the microscope. This is called histologic confirmation. Omitting such confirmation is not appropriate. First of all, not all lumps are cancer. Second of all, we need to learn a lot about that tumor to design the right treatment plan to offer you. So the first thing that happens is a diagnostic set of images and tissue, or a biopsy. Sometimes you'll hear oncologists or radiologists saying, the rumor is tumor, the issue is tissue. We have to get that tissue confirmation. What happens after that depends on a lot of different things. It depends on the size of the tumor relative to the breast, and it also depends on sometimes other characteristics of the tumor, how rapidly it's grown, or some of the markers that we see under the microscope in the pathology lab. After you've been diagnosed with breast cancer and there's some familiarity with what the tumor markers are, the extent of disease in the breast, you will proceed to one of two pathways. The first is surgery, where the cancer is removed and perhaps the lymph nodes are looked at as well, depending on the cancer. And the second would be to start with systemic therapy, where we give chemotherapy and targeted therapy or endocrine therapy before surgery. Let's start with the surgery first. This is the most common scenario. After a diagnosis, we like to move to surgery within a few weeks to months. If the tumor is more aggressive, we get you into treatment more quickly. If you have an estrogen receptor positive tumor, sometimes we wait up to 2 months, depending on the availability of your surgeon and other things going on in your life. If you have surgery first, the recovery time is generally 2 to 3 weeks for lumpectomy and 6 weeks for mastectomy, maybe a little longer if you have reconstruction. I do advise people, though, to take up to 6 weeks before they expect that they'll be heading back to normal. Your body's working really hard to heal after surgery. Even if you have a small incision, give yourself the time to heal before you return to work or your busy life that I know you're leading already. So that would be diagnosis and surgery, and then we proceed to, if you're going to have chemotherapy and targeted therapy, those go next before radiation therapy. Radiation therapy is generally at the end, along with endocrine therapy. So if you're getting all the treatments, you get diagnosed, you get surgery, you get chemotherapy, maybe targeted therapy, then radiation therapy, and then endocrine therapy. Endocrine therapy can start along with radiation therapy. That's the general order if you proceed with surgery first. If you start with systemic therapy means it goes through your whole system. It treats not just the tumor in the breast, but any cells that may have escaped. If you start with that, surgery will be afterwards. Do not worry about that delay. The point is to treat the cancer in the breast and the rest of the body. Chemotherapy can vary in length. You can have 3 months of treatment with chemotherapy, or you can have 6 months. Between 3 and 6 months is pretty standard. If you're getting this after surgery, we wait to start until the wound has healed. So surgery, then chemo, we wait. If we're starting with chemotherapy, you can proceed to surgery usually 2 to 3 weeks after your chemotherapy. And then, as before, radiation therapy and, if appropriate, endocrine therapy. A special word about targeted therapy. Targeted therapy generally continues for a year. Once you finish chemotherapy, you can proceed to surgery and radiation therapy even when you're still on targeted therapy. Targeted therapy doesn't stop. We don't like to stop and wait for weeks while you're undergoing surgery and radiation therapy. It continues apace on schedule. I know I've covered a lot. We haven't even talked about endocrine therapy in 5 versus 10 years. We have a whole playlist on endocrine therapy I'd love to invite you to view. I would also love to invite you to go to Yerbba.com to get your personalized Yerbba report. Your Yerbba report is created by, after you grant us permission, cross-referencing everything that's been done, all the test results, all the procedures or any treatments that you've had with the latest medical evidence. And then it generates for you a personalized report that gets updated as new things happen. As you have more data come back, more tests coming back, more procedures done, it updates that. So your Yerbba report is updated in close to real time. This is really different from your portal because it's going deep, deep into your medical records and because it's cross-referenced with the latest medical research. So go to Yerbba.com, get your personalized report, and if you get the premium version, you can ask questions of Yerbba, and you'll get an answer usually within 1 to 2 days. We do systemic therapy first for a whole host of reasons, not just to improve the surgical outcomes. Sometimes we'll do it because somebody wants to do genetic counseling and testing before they have surgery. And by the time they get in to see the genetic counselor and get their test results back, they might be halfway through their chemotherapy. Another reason that we might do chemotherapy first is if you want to have immediate reconstruction and you can't get into the plastic surgeon soon enough, you want to have it done at the time the breast is removed, we can get systemic therapy done while you take your time figuring out the type of surgery you want, meeting with the plastic surgeon, and setting all of that up. So there's some good reasons where we wouldn't do surgery first, but it is the most common scenario. Who's more likely to get systemic therapy before surgery? People with triple-negative breast cancer, so estrogen receptor, progesterone receptor, and HER2 negative, are more likely to get chemotherapy before surgery. And even if the tumor is HER2 positive, anybody with a tumor 2 centimeters or over, because we can give chemotherapy and targeted therapy before surgery. I hope this has been interesting and helpful for you. Drop a comment or question below. And thanks as always for watching. We'll see you next time.